Hello, everyone. My name is Rachel Adams, and I'm a postdoctoral research associate at the National Science Foundation-supported CONVERGE initiative, which is headquartered at the Natural Hazards Center at the University of Colorado Boulder. During this 90-minute webinar, we are going to provide an overview of the CONVERGE training module series and provide a demonstration of the social vulnerability and disasters training module. We are so grateful that you have joined us today at the virtual National Hurricane Conference. For today's presentation, we are going to start off by introducing you to the CONVERGE initiative and our different projects. We will then provide an overview of the CONVERGE training module series. We will also walk through a demonstration of the social vulnerability and disasters training module, and we will end with a 15-minute question and answer period and some closing remarks. Today, I will be presenting alongside Hao-Rui Wu, who is an assistant professor at Dalhousie University's School of Social Work and a research affiliate at the Natural Hazards Center and CONVERGE. Hao-Rui, take it away.
Thank you so much for the introduction, Rachel. Before we continue, I want to acknowledge that the work we are presenting today is supported by one award from the National Science Foundation, Divisions of Civil, Mechanical, and Manufacturing Innovation, Program on Humans, Disasters, and the Built Environment, with supplement support from the Centers for Disease Control and Prevention. CONVERGE is the most recently funded NERI component. It is dedicated to advancing coordinated, ethical, and scientifically rigorous research that brings together engineers, social scientists, and other researchers into interdisciplinary projects focused on solving vaccine challenges to reducing hazards losses. CONVERGE is headquartered at the Natural Hazards Center at the University of Colorado Boulder, which is a National Science Foundation designated information clearinghouse for the societal dimensions of hazards and disasters. The Natural Hazards Center is dedicated to reducing disaster harm through the following 4 aspects. First, translating and sharing hazard and disaster research and information. Second, building connections between researchers, nonprofit and private sector professionals, the media, policymakers, and the local, state, and federal officials. Third, advancing social science and interdisciplinary knowledge with a special emphasis on the most vulnerable populations and species. The last one, training and mentoring the diverse next generation of hazards and disaster professionals. To find out more about CONVERGE and the Natural Hazards Center, we encourage you to sign up for updates and resources at converge.colorado.edu/sign-up and hazards.colorado.edu/sign-up. You may ask that why CONVERGE? Convergence science is one of the NSF 10 big ideas. The mission areas driving CONVERGE are rooted in convergence science. The facility is about bringing science and engineering to bear on major problems, and it is solution-based. CONVERGE is a NSF Natural Hazards Engineering Research Infrastructure Facility, or NERI. It's dedicated to, first, identifying and coordinating researchers and research team, supporting and accelerating training and mentoring to advance the ethical conduct and scientific rigor of hazard and disaster research. Third, funding virtual reconnaissance, field research, and the development of novel research instruments and data collection portals. Fourth, encouraging the publication of data and data collection instruments and protocols through our collaboration with Design Safe cyber infrastructure. The last task is accelerating the development of mobile applicants for social science and interdisciplinary field data collection through our collaboration with the Near-Ray Rapid facility. Later, I will introduce both facilities, Design Safe and Rapid facility. To further the mission to identify and coordinate research teams, the NSF now funds 7 extreme event reconnaissance or research networks. You will see that on the screen. They are all known as EERs. To give you a concrete example of how NSF supported the EERs has advanced the mission to identify and coordinate researchers, see this is an example from ASEAN map. To date, nearly 1,000 social scientists who study hazards and disasters globally have signed for the network. When a disaster happens, the ASEAN map and the network can mobilize to contact and coordinate locally affected researchers and set a scientific agenda in response to emergent research needs. The ASEAN map includes information on researchers related to their methodological expertise, disasters they have studied, social scientific disciplines, and etc. CONVERGE also hosts the virtual forums where members of the ASEAN network can communicate during a disaster. For instance, on January 17th, CONVERGE hosts a forum where local affected researchers and others conducting research in Puerto Rico during the December and January earthquake could share information and resources and identify pressing areas for ethical coordination and social scientific investigation. The Leadership Corps brings together NSF principal investigators for the EER networks and the Near-Ray component that support their work. The NSF Near-Ray Rapid facility, which is headquartered at the University of Washington, Seattle, provides researchers with equipment, software, training, and other support services needed to collect, process, and analyze perishable data from natural hazards events. CONVERGE is partnering with Rapid to advance the Rapid app, which is a mobile application to support the secure collection of qualitative, quantitative, and mixed methods hazard and disaster data. Design Safe is a web-based cyber infrastructure platform for the NSF Natural Hazard Engineering Research Infrastructure Network. Headquartered at the University of Texas, Austin, Design Safe provides a secure data repository and the computation tools needed to manage, analyze, and publish crucial data for hazard and disaster research. Together with Rapid Facility, CONVERGE is partnering with Design Safe to develop a novel social science and interdisciplinary data model for natural hazards research. This data model will allow social science and behavioral scientists and members of interdisciplinary teams to publish qualitative, quantitative, and mixed methods data. CONVERGE is also involved in a check sheet series where we produce short 1 to 2 page graphic check sheet that can be used as researchers design their studies, prepare to enter into the field, conduct field research, and access the field. We are also partnering with the Journal of Natural Hazards Review on a peer-reviewed briefing sheet series. The series, which is currently in development, will offer best practice for extreme event research and consists of short, freely accessible publications. This past April, CONVERGE founded 89 working groups focusing on different aspects of COVID-19. We have also established a COVID-19 global research registry for public health and social sciences. Before we continue, I want to see if anyone has any questions about the CONVERGE or the Natural Hazard Center. You can enter your questions in the chat box on the right-hand side of your screen. Okay, since I haven't seen any questions here, but if you have any questions, please put that in your chat box. We will address that by the end of this presentation. Now, I'm going to hand over the presentation to my colleagues, Dr. Rachel Adams, who is going to introduce you to the CONVERGE training modules.
Thank you so much, Harry. So, Harry, do you mind putting your screen on mute? Thank you. So, what are the CONVERGE training modules? Well, they are free online courses available at converge.training.colorado.edu. They are designed for hazards and disaster researchers and practitioners with a special emphasis on students, emerging researchers, and others who are new to the field. They take approximately 30 to 60 minutes to complete, and you can register at converge-training.colorado.edu/register. Currently, we have 4 modules available: social vulnerability and disasters, disaster mental health, cultural competence in hazards and disaster research, and institutional review board and extreme events research. Several other modules are coming soon and are in various stages of development, including conducting emotionally challenging research, ending gender-based violence in fieldwork, broader ethical considerations for hazards and disaster researchers, and social science methods and approaches for extreme events. I'm now going to walk you through an overview of the CONVERGE training modules. Each training module begins with a clear list of learning objectives broken down into 4 main lessons of the module: background, methodological approaches, knowledge to action, and future directions. For the social vulnerability and disasters module, the learning objectives state that by the end of the module, users should be able to define social vulnerability, understand the conditions and drivers that influence social vulnerability to disasters in the US, identify potentially vulnerable groups, and recognize the physical, psychological, and social factors that may amplify their vulnerability to hazards and disasters, explain the primary methodological approaches to studying social vulnerability, underscore the importance of ethical conduct of research, recognize how studying vulnerable populations improves hazards and disaster practice and policy, understand how research on vulnerable populations can improve outcomes for individuals and enhance community resilience, recognize future directions for social vulnerability research, and finally, learn about additional resources that support hazards and disaster research on vulnerable populations. As users progress through the module, they can follow along using a tracking bar on the right-hand side of the page. Users may also stop the module at any time and reconvene at the same place at a later date by logging into their account. To present information The modules use examples and case studies throughout. For instance, in the Social Vulnerability and Disasters training module, pictured here, we present examples of vulnerable populations, such as children and older adults, and key statistics from past disasters. Logic models and other figures are also used to summarize key information. For example, in the Disaster Mental Health module, we summarize risk factors that influence disaster mental health outcomes over time. Examples of methods are presented by highlighting specific case studies, including journal articles from past research using these different methods. The case study approach is something that we use across all of the modules. For instance, picture here is a section on trainings to enhance cultural competence in hazards and disaster research that comes from the cultural competence training module. The modules also incorporate interactive sliders, such as the 10 recommendations for future research or practice section, which is located at the end of several of the modules, in order to encourage people to answer some unanswered questions or gaps in the literature in the field. For instance, here, in the example presented, we recommend that hazards and disaster researchers develop pre-event protocols to facilitate IRB approval for time-sensitive studies. This is one of the recommendations we provided in the IRB and extreme events research training module. In addition to the module's written and interactive visual content, we've compiled a list of additional resources relevant to conducting research. Within the Resources tab at the top right-hand corner of the screen, we provide links to measures, tools, datasets, key readings, trainings, and other relevant resources. At the end of the module, users can take a 10-question quiz to assess what was learned. This means that these training modules can be used as a class assignment or other competency requirement. If you're an instructor considering these for classroom use, please know that we have a quiz bank that is on a random generator. That means if you assign these trainings, users will not get the same questions. If you get at least 8 out of the 10 questions correct on the final quiz, you will receive a certificate of completion with your name and the date. You can save this certificate as a PDF and can also access it at a later date via your training module login information. These certificates are intended to become part of a larger credentialing system to train the next generation of hazards and disaster researchers. I'm now going to go to the training module website and actually provide you with a demonstration of the Social Vulnerability and Disasters training module. Give me a moment while I switch screens. So here I am logged into the training module website. For the sake of time, I'm just going to guide you through the knowledge to action lesson. This lesson explores why research on vulnerable populations is so important and highlights advancements made through evidence-based action. So below this lesson, we have the lesson content below, and the first topic in this lesson is allocating resources. Here, the module presents how research on socially vulnerable groups can guide resource allocation before, during, and after a disaster. An example of this type of practice is the U.S. Department of Health and Human Services Empower Map, which is a publicly accessible interactive map that allows users to geographically locate Medicare beneficiaries who rely on electricity-dependent medical equipment. In the context of a disaster, emergency responders, practitioners, public officials, and community members can utilize this map to identify the specific zip codes where these beneficiaries reside, helping to streamline the allocation of emergency resources to these highly vulnerable individuals in a timely manner. So after you finish reading through the topic, you can scroll down the page and press next topic to move on. In this next topic, informing messaging and communications, an example of research guiding practice is presented. The CDC's Crisis and Emergency Risk Communication, or CIRC, manual was developed using psychological and communication sciences, studies in issues management, and practical lessons learned from emergency response. The CIRC manual provides guidance on how to tailor emergency communication materials to different at-risk groups and recommends that all materials consider the following characteristics of the target population: age, languages spoken and read, education and reading level, income level, religious beliefs, cultural values, beliefs, and practices, and level of trust in response organizations and agencies. The Protect Your Pregnancy from Zika fact sheet, pictured here, is an example of a tailored communication campaign targeting low literacy pregnant women in the United States. One thing to note, too, is that throughout the module, when you hover over one of the numbered citations, such as the one over here, you will actually see the reference pop up. You can also toggle the citations at the bottom of the page, where often you can actually retrieve them via website. And so all the references that were used to build this module are also included in an interactive way so that users too can use those references. The next topic is advancing training and development. The example presented here is the Vulnerable and At-Risk Toolkit developed by At-Risk Populations Toolkit developed by the North Carolina Preparedness and Emergency Response Center at the UNC Gilling School of Public Health. This toolkit is an online repository of resources, maps, case studies, and presentation templates designed to guide health departments in their preparedness and planning efforts for vulnerable populations. Using this toolkit, local, state, and tribal health officials can access and download resources that can help to identify and plan for vulnerable populations in their specific jurisdictional areas. The next topic is developing policies to safeguard vulnerable populations. This topic presents the Post-Katrina Emergency Management Reform Act of 2006. After Hurricane Katrina, this policy was developed and passed at the national level. This important policy document outlined provisions aimed at restructuring the organization of FEMA in order to better anticipate the perspectives, needs, and concerns of vulnerable populations during a disaster. Examples of these provisions include the establishment of a disability coordinator and specific guidelines for accommodating individuals with disabilities and other functional and access needs, the development of the National Emergency Family Registry and locator system to help reunite families, the transportation assistance for relocation and return of individuals displaced from their homes, and the appointment of an advocate for small states and rural areas. The last topic of this lesson is improving disaster outcomes among vulnerable populations. Here, we present a logic model linking social vulnerability research to specific research outcomes, policy and practice, and finally, to actual population outcomes. At the end of each lesson, there's a brief knowledge check, which is a 2-question quiz to make sure that you are engaged and paying attention. The knowledge check does not count towards the final quiz. For those of you joining via your screen, you can see 2 multiple choice questions. The first question asks, what year was the Post-Katrina Emergency Management Reform Act passed? There are 4 response options: 2004, 2006, 2008, and 2018. I'm going to enter the 2006 response. This second question asks, the Vulnerable and At-Risk Populations, or VARP Resource Guide Toolkit was developed by which of the following organizations or centers? The response options are the Centers for Disease Control and Prevention, the Federal Emergency Management Agency, North Carolina Preparedness and Emergency Response Research Center, and Duke University. I am going to choose North Carolina Preparedness and Emergency Response Research Center. To submit my responses, as you saw, I press Finish Assessment, and now I have the option to view my questions to see whether I got them correct. And as you can see, both of the questions were correct. I wanted to point out one more thing during this demonstration. As I mentioned earlier, the module has a resources tab where additional resources are listed that can support research on social vulnerability and disasters. These resources include social vulnerability measures, other web resources, secondary data sets, and key readings. The key readings consist of highly cited journal articles that focus on different vulnerable groups in disaster, as well as notable review articles. Each of these resources is also hyperlinked. So for example, if I were to press the CDC's Social Vulnerability Index, it would bring me to their website so I could actually access this resource. So that concludes the demonstration portion of our presentation today. We are now going to return to the webinar slides. So now that you've seen how the module looks and works, we're hoping to spend some time to do some Q&A. So to start off, does anyone have any specific questions from what they've seen so far? If so, please enter them in the chat box on the right-hand side of the GoToWebinar screen, and we'll wait a few moments. And if not, I will pose some of the questions written here to the participants. Well, I see that there aren't any questions that are coming up in the chat box. And so how about I ask some of the questions to the participants, and I would hope that they would want to answer and provide us with feedback to improve our training modules. So the first question I have for the group is, what are your thoughts or general impressions of the training modules presented? And I do recognize that being a virtual webinar as opposed to an in-person presentation can make people a little hesitant, but I do hope that you all feel comfortable providing some of the general feedback about what you've learned about today in our presentation. All right, I'll follow up with a second question then. How would you use these modules in your work? Or maybe instead of your work, who might you recommend these modules to? Or would you require them for training for any particular group, such as students or employees? In knowing the 4 topics that we presented on, or the currently available training modules, the one on social vulnerability and disasters that I provided a demonstration on, disaster mental health, institutional review boards and extreme events research, and cultural competence for hazards and disaster researchers, are there any other topics that you would like to see develop into a training module? And lastly, is there any additional feedback that you would like to share? I realize that the online format for a presentation is new to most of us, given these unprecedented times we're living in. And so I do encourage you, if you do have any questions or any ideas or feedback that you would like to provide with us at a later date, you can always contact us at converge.colorado.edu. So a few reminders before we close out this session. As I said, to contact us about any questions you may have, please email us at converge@colorado.edu. And to register for and access the Converge training modules, please visit converge.colorado.edu/training-modules. Again, we wanted to acknowledge that the training modules were supported by the National Science Foundation with supplemental support from the Centers for Disease Control and Prevention. We also want to acknowledge the entire team at the Natural Hazards Center. Everyone has contributed to these modules in some way, either through reviewing, testing, or otherwise supporting this effort. Our team here also wants to give a call out to nearly 30 NSF supported research experience for undergraduate students who tested the social vulnerability and disasters module last summer. These students were located at Natural Hazard Engineering Research Infrastructure, or NHERI, facilities across the nation, and they took the time to take this module and provide us with written, detailed feedback, which we incorporated. Finally, we want to thank you all for joining us today. We sincerely hope you will consider adopting this module for your classroom or workplaces so that you will share this with your colleagues. Thank you again for your support, and please contact us at converge@colorado.edu if you have any questions, comments, or suggestions for how we can best share this module with others. Also, please visit converge.colorado.edu/sign-up to receive future alerts regarding these training modules and many other resources being developed from Converge. Have a great day, everyone.